Halloween is over, we've had our fill of sweets, and now it's time to turn our attention to the biggest eating holiday of the year, Thanksgiving. Overindulging ourselves could lead to acid reflux, a common symptom associated with Gerd. The International Foundation for Functional Gastrointestinal Disorders designates November 18th through the 24th as Gerd Awareness Week. Dr. Garth of Advanced Gastroenterology and Surgery Associates explains the symptoms and treatment options available for those with the condition.
Gerd just means gastroesophageal reflux disease, so it's basically the same thing. It actually is a motility disorder. People normally think that it's just acid, but it's just reflux of gastric contents into the esophagus that causes the symptom. So it really is a motility problem. It's a problem of refluxing. We all have transient relaxation of the muscle at the end of the esophagus, so we all get a little bit of reflux. If you eat a pizza or fried foods, fatty foods, you get a little bit of reflux. But some people get it much more often. People with hiatal hernias, where part of the stomach is slid up into the chest, tend to be more prone to get acid reflux, and they tend to have more significant problems. But it really is a motility disorder. The medications, however, that we have actually just control the acid. They don't really prevent the reflux of gastric contents. That's why the anti-reflux measures, elevating the head of the bed, avoiding lying down postprandially, avoiding some types of food, some medications are vitally important, because you really have no great motility drugs to treat acid reflux. Cough is one of the extraesophageal manifestations of acid reflux. So people can reflux gastric contents all the way up the esophagus, can present with hoarseness. As a matter of fact, most of those patients actually are seen initially by an ENT physician. Like everything else, there probably could be some genetic components, but it's so common. And like I said before, we all reflux to a certain extent. I think lifestyle sort of exacerbates it. So elevating the head of the bed is extremely important. We normally recommend 6 to 8 inches with blocks or a wedge. And of course as well, not lying down after eating, because you want the stomach to empty at least 3 to 4 hours after a meal. You shouldn't lay down, because then you sort of increase the chances of reflux of gastric contents.
Dr. George suggests we be extra cautious around the holiday foods that most commonly aggravate symptoms: chocolate, caffeine, onions, fried or fatty foods, alcoholic beverages, and even peppermint may cause reflux.